Welcome to the Public Figure Society podcast, where innovation meets influence. If you're building a brand, leading a movement, or shaping the future, you are in the right place. We bring you the insights, strategies, and stories that fuel the world's most impactful public figures. It is time to step up, stand out, and leave your mark. Let's dive in. Welcome to the Public Figure Society podcast. I am so excited to have David Schneider. We met celebrating the RFK Jr.'s nomination and then being confirmed as HHS secretary, and we were at Invita Health, and I got to meet him, and he's talking about that he has been the AI sphere business industry for many years, and he right now is the COO of Dane Health, which is an AI-powered clinical assessment. And so we're going to talk about AI in health, which last time we talked about AI in cars. So welcome, David.
Thank you. Thank you for having me. Pleasure to be here.
So I would love to get a little bit of your background. How did you get into Dane Health, and how did that all happen?
Sure. I met Dr. Patel actually at an event called AI Med, and that was started by Dr. Anthony Chang, and he started that some years ago. I was at the very first ones. It's a conference for clinicians and technology experts for AI in medicine, and that went on. Dr. Anthony Chang also founded MI10.ai, which is a consultancy that provides AI education for clinicians, and I'm also a founder there. So at these conferences, you meet people at events, and I met Dr. Patel. I liked what he was trying to do. I was otherwise involved at the time, but then some years later, he said, "Hey, I have this idea. Should we do it?" And off we went.
That's so great. And so what is it? Tell us a little bit about Dane Health. What do you actually do in the space?
Yeah, so what we focus on, and it could be expanded, but what we're currently focusing on is brain health, specifically brain injury recovery. So many people will have concussions or head injuries and they don't know it. So an example of that, people that go to the ER, often 50% of the traumatic brain injuries that where a person has been in the ER are actually not diagnosed. And that's not a failing of the emergency room or the clinicians there. It's simply that they're fixing you up for something else, and they don't know that you banged your head, right? And you never mention it, so they just don't know.
Okay.
So you're all repaired and patched up, and off you go. And it turns out you had a brain injury. Now, most of them, most people, you bang your head and you recover, right? But there is a percentage of them, and it varies depending on lots of circumstances, but let's call it 10%, that the brain injury doesn't actually fully heal. The brain is very plastic, right? It grows around problems. The problem is as it grows around them, you develop new behaviors, new thought patterns. And so people can, entire personas can change over time, and they can end up in a lot of difficult spaces where they have other outcomes, right? Disorders and family issues and mental health issues. So that was our focus. Let's look at this large population that could get some help, and see what we can find. Let's assess them.
I love what you said, that the brain grows around the problem. That is a really interesting concept. Could you tell more about that? I never thought I know the brain is plastic, but I didn't realize that's how the brain works.
Yeah, so if it has an area that's injured, right, it develops new connections around it. Because that's its job, right? It has to be flexible, right? I lost function in this area, I lost sensors in this area. So it tries to adapt. The challenge of that is in its adaptation, right? It is literally neurons are connected to neurons. Right? So it is now in a different literal physical path, and that can actually change behaviors and thoughts and even things that you taste and like, right? Mm-hmm. And that can lead to a lot of problems for those that don't take care of the problem. And so we thought this is a really pretty solid niche to go after, recognizing that the AI could provide other benefits, but here's an easy one that we could go really help a lot of people.
So how does your tool help? So basically you're saying is it's someone that's got a brain injury, mm-hmm. and what you're saying is you're warning the brain injury. When you have an injury, you could actually be growing and reacting to life in a different pattern. You could change your behavior, change the way you're doing things. And so what does Dane Health's AI component help with the person that's got a brain injury?
That's a great question. So because people don't get assessed and they don't know that they have it, what happens when you go to your physician, right? You fill out a form like, have you been depressed in the last 30 days, right? And everybody goes, no, because they don't want to go through that problem. And they're not asked again about the problem. So it turned out we did some pilot studies. One of them was fairly large with 3,400 people. And it turned out people will talk to the AI and tell it everything. It was an open pilot. Everybody knew that we were going to look at the data. And so some didn't participate, but that's okay. But those that participated turned out would just tell the AI everything. Oh, I'm not feeling that good. My dog died. Oh, I have a broken sink or whatever. And that's why I'm feeling bad. And I really want to get it fixed, but the plumber won't come over. Right? They just pouring their guts out to the AI. And we realized this is fantastic. They will tell the AI what they won't tell their physician.
Really?
Yeah. And the AI is infinitely patient. That's part of it, right? So people with a brain injury, not always, but can have a problem with attention. They get headaches talking about certain things, and so they'll stop. Well, your physician doesn't have an hour to talk to you about this, right? Well, the AI does, and the AI doesn't care if you talk to it and then stop and then come back at 3 a.m. It's fine, right? It's the same perfectly happy AI that you were talking to at 2 p.m. So that's the other benefit, is right. It's a 24/7 by 365, always friendly, always ready, knows who you are, ready to pick back up. We control a lot around that also, because you're thinking, well, ChatGPT does that. And no, ChatGPT does not do that. First off, they'll all refuse to perform any clinical assessment. But they also will veer off from topic.
Right. Wow. So you've trained the AI then? Is that what you've done? Or
Yeah, we do. We use a proprietary technology that does, it's a mathematical concept, graphs, and we guide the generative AI using a graph, so it never leaves topic. It's very friendly. It'll talk to you about lots of stuff, but eventually it goes, hey, let's talk about this next thing.
This is so fascinating. So basically, AI is taking on a role of helping us do you think they're going to take away the role of a counselor?
No. In fact, we've been asked that. It's not a counselor. It's the assistant to the counselor, right? It's the infinitely patient assistant to the counselor. Listen, we have a large population of ESL, right? English is a second language.
Right.
From all over the world, right? And, if they, I know that's probably inappropriate to say or whatever, but it's English, right? People will flip back and forth, right? Well, that could be hard for a counselor. It's not hard for the AI. No problem. You can go from English to Spanish to French to Vietnamese. We actually tested this back, and the AI doesn't lose a beat.
I love that about AI because I'm dual citizen and dual language with Norwegian and English. So sometimes when I get really tired, that's when I know that my first language is Norwegian, because I'll think Norwegian, I'll talk Norwegian. And so then sometimes you'll have the Norwegian sentence and then it goes over to English. And I was so surprised when I hand that over to chat, can you put this all in one language for me, please? And it does.
And it does. The fantastic thing about a language model isn't that it's smart and isn't that it knows anything. It doesn't. But it is a language model, and we communicate using language. So it certainly seems smart because you can ask it questions in a language, and it gives you back a really nice answer in that language. You can prove lots of ways that it has no idea what it's talking about. What's 10 plus 6 plus 5, and it'll make up an answer. But some of them are getting slightly better at that. But it is really good talking to you, right? It uses language, and that's what's beautiful about it.
Wow. So that is so fascinating, because you're really showcasing another place, because the whole idea of Public Figure Society is that we're all becoming public figures, and we're going to have this invisible task force that's making you shine, because that's what you do with politicians and musicians. You help them shine out there in the public. So AI tools are going to help us shine more in the public. So This is a very interesting tool to help. So who uses the tool?
So that is another fantastic question. There are a lot of possible markets, as you can imagine. One easy market is the accident market, the accident attorney market, right? People get in accidents, they probably bump their head. Here's a 24/7, 365 multilingual tool, assess for brain injury. The clinical market, right? Obviously, neurologists, etc. Great market. There is a consumer-facing market. Right? Hey, I don't feel good. I think I banged my head. Right? We are focusing right now on the clinical market. We actually do have a legal product. It's a little bit of a lift with legal, even though you'd think it isn't, because you are taking away a human interaction that they actually want. I don't think they fully see the value of it yet.
What do you mean by that? That's a very interesting sentence you said. Taking away a human relationship that they want. Could you please?
Yeah. So you call up, an accident attorney, right? And someone's talking to you, a human being, right? That can show empathy and lots of other things. And they still tend to want that human touch there. It is larger firms though are recognizing, and we're in talks with several, that people call them at 3 a.m. and having multilingual staff available at 3 a.m. And it's like an ER, right?
Right.
A bunch of equipment and very well-trained people. And if nothing happens, it still costs a lot of money, right? But you want them there. So they're starting to realize the value of the ER or of the AI in that case is similar to that, right? You vastly lower the cost of this 24/7 multilingual capability. In the clinical space, it's a little easier, right? You can do a pre-assessment before someone comes in for an appointment. You can monitor them between appointments. And I think the value proposition there is pretty easy to understand from everybody's standpoint.
So basically what would happen if I was going to utilize this tool, say if I had a brain injury and I was going to have this tool, and do I do it as an individual, come to your service, or do I do it through a clinician? So I have a head injury and I go to the doctor, but you're kind of helping even before that. So how would I know when to use it and not to use it?
It's a great question. Right now, our primary focus is a professional is guiding you to use it. So,
okay, guiding you. Okay.
Yeah. So the clinician will say, "Hey, I'd like you to take this before you come in. Take this assessment." And that's helpful to them because it will provide guidance to you. For example, if it catches a red flag, it goes, "You need to go to the ER now," right?
Right.
But it also provides a clinical report and summary to the clinician that he reads. So that summarizes kind of the entire conversation and all the scores and everything else. So he knows what domains and subdomains to look at, right? Maybe you have a vestibular problem, like your balance, right? Maybe you have like throbbing headaches here or whatever. Now he knows where to look and doesn't have to ask you all that up front.
So basically what you're saying with Dane Health is that it's for clinicians right now. So if I go to one of the clinicians that has Dane Health, they will then, before they even do the appointment, I will then go through this AI tool. And how do they message that so people feel comfortable with that?
Well, it comes right from your physician. And it's a link in the email. So
it's a link in the email. Okay.
Yeah, and then you click on the link, and it's one of those custom links, and it does the whole little verify that you're actually the guy, right? Clicking it.
Okay.
And then you take it, and then it says, "Hey, I'm preparing a report for your physician, and if it has any guidance for you, it provides it. Depends on the thing. One of the things, I'll give you an example. You've had headaches. How long have you had headaches? I've had headaches for like 3 years. What do you have remedies? I use acetaminophen. Is that still working for you? No, I keep having to take larger doses. Well, that's because acetaminophen stops working for headaches after a while. It has a decreasing efficacy against headaches, especially if you keep taking it for headaches. A lot of people don't know that, right? But it provides these basic guidances that kind of help you go, hey, maybe you should try ibuprofen, right? Unless you're allergic to it. And it goes through that too. So.
Wow, so it's like a diagnostic tool.
Not diagnostic. You can't use that term.
I know, but it's kind of, but what it's doing is it's basically helping you to understand more the problem of what the person's having. And by using a language model where you're basically saying that they tell more to the AI, you're somehow lifting the barrier and they have time to explain it as much as they want. And I think that's
correct.
Key.
Yeah, it's patient, it listens. It's using language models, so it's talking to you in a comfortable way. And then behind the scenes, it's doing evaluations using other AI and whatnot and on how you're responding. So the doctor really knows a lot more about you when you walk in the door.
So they're better prepared to help you.
And we all know clinicians have, they're already overloaded. So.
Wow, this saves a lot of time for clinicians and probably money in a way.
It saves time, makes them more efficient, and enables them to give you better care, right? Because it should be data driven. They have a lot more data on you. And now between visits, it can continue to collect data. So they have even more data on you, and it's longitudinal. They know how things are happening over time, right? So they can see how things are progressing. So it's a invaluable way to provide the clinician more data.
So the clinicians that have used it, what do they think about it?
They like it a lot. Clinicians are very particular people, as they should be.
Yes, they are.
So we have got a lot of feedback, and we're continually tuning it. But they like it. They really do like it. And you have to satisfy a lot of different clinicians. But we're at a point where we think we'll be rolling out. I can't say the hospital systems yet, but through several hospital systems and their associated, facilities and attending physicians in the area of neurology and brain injury. So we're pretty excited about that.
But this could actually go a lot bigger and a lot more,
Yes.
because I think what's really interesting about what you're doing, this could even help with businesses before you meet with someone, like having them to chat about, how like you're diagnosing a client, or I don't want to say diagnose, but you're trying to assess the client,
Yes.
what kind of service you're going to provide, but having some AI that's friendly, asking questions, talking in a friendly manner, it's a very powerful tool.
It is. We have, I'm the operating officer, so I also have a background, obviously, in technology and AI. We have debated hotly at board meetings, how broad do you make it? Because you're right, it is an AI tool that could help anybody. And it is essentially, and this is where you get into ethics and morals and all that other stuff.
Right.
It is essentially an hourly replacement for somebody, right? It's a 24/7 multilingual, never blinking, infinitely parallel hourly worker.
Right.
How much would you pay for that? If it knew your business well, would you pay $15 an hour? Yeah, you would, right? Would you pay $20 an hour? Probably.
Right.
Except that if you only need one guy, this guy only costs you $20 an hour. And if suddenly you need 1,000, you got 1,000 of them working.
Right. Wow, that's interesting.
But
Wow.
you do get into the question of,
Yeah.
that takes a lot of jobs.
So you think it's going to take a lot of jobs away?
In those types of cases, it definitely is going to be taking some jobs. And so then you have to decide how you're going to redeploy those people, right?
Right. But do you think they're taking away a job, or are they just taking more of a job that wasn't really there? Like, right. So
That's a really good point.
because to me, it seems like you've gotten less quality by having a counselor that doesn't spend that hour of time, right? So you're saving the patient time by having them actually being able to maximize what's wrong with them, right? They go to the clinician is able to maximize its service to that person, and you're actually saving time of the patient, not having to run around to so many different clinicians to find what the solution is, that you're actually creating a higher quality of that one person.
You know what? So, as business people that want to help people with healthcare, like we do try to think about the whole universe, like how are we negatively affecting anything? But actually, you have a really good point. Maybe we should think about it that way. We're improving the quality and giving the human not taking their job. They're giving them more time to do what they do really well. That's a good point. Yeah, that's true. You're right.
No, because I think the biggest problem with doctors is because they don't listen, right? And they don't have time to listen. I mean, they're so overworked, and the patient feels really helpless. That's probably why they're confessing more to the AI. They're feeling that they have the time, they have the patience. Because when you go to a doctor, you get kind of nervous when they're just looking at you, and you're like, "What's wrong with you?
What's wrong?"
You talk more to the nurse, right? But the nurse doesn't have time, right? And so this is it's almost like I don't know if you're into blue ocean strategy, but I really believe in the blue ocean strategy, that there's a new competitive market that never has really been there. And it seems like that's what you're really supplying, is like a whole new way of looking at healthcare, because you're creating greater quality between the two relationships.
Yeah, that is true. And you're right, the job isn't there now because they can't afford to hire 20 new counselors, right? But the AI, you can, again, because one AI counselor sitting there in case it's needed that's $20, right? And if suddenly you need 100 of them, fine, there's 100, right? It duplicates itself. So that's a really good point. And we like that. If you're in healthcare, you want to help people somehow.
Right, you do.
Right? So,
you do. But so what do you think in your philosophy? I think this is so interesting. You're saying that we are willing to say more to an AI. What is your reflection on that, and what's the reflection of your team? I think that's such an interesting.
So some of us are gamers also, and have
Okay.
been. Okay.
So what's your favorite game?
Well, I play a few different games. I play one larger one called it's a Star Trek Fleet Command. Yeah, I also play the Division 2. I don't want to hear comments about conspiracy theories, everything else about that game, but it's a fun game. Um, anyway, but the point is, there's, in those conversations, and the groups that I play with, those games tend to be older guys, a lot of them, executives or ex-military, etc. So we have a good time, usually probably playing around 1 a.m., all of us having a drink, chatting and
Oh,
doing the
fun!
game. Yeah, it's a fun thing. But, as you're talking, these are, a lot of them are professionals, right, that I've met and whatnot, and you go, what are people doing? Well, they're not admitting at work what's really wrong to their boss or to HR, because employees now view as HR as the enemy. Okay.
Yeah, they do.
As a company, I actually want to know what is going wrong, right? There's not a
Right.
company in the world that goes, I hope we work worse today, right? You want your staff is your company, right? So they're getting frustrated. And a few of them said, they'll sit there and they'll talk to their friends about it. And some of them were starting to talk to ChatGPT about it, right? And I'm like, the light bulb went off and I said, yeah, listen, I'll talk to my buddies about stuff that I'm not
Right.
going to talk about elsewhere, right?
Right.
And I'm going to talk to the ChatGPT, some people, not me, but other people, will just, they don't have their buddy group, whatever, and they're talking to them.
Right.
Like, so it does actually align. I'm not sure what it says about our society and social interactions.
Right.
Not above my pay grade, but
Yeah.
I think we should get back to some of that human interaction, but it seems to be the truth.
Yeah, no, that's a fascinating. So, what do you think is going to happen? Like, from your perspective, society-wise, we're getting this invisible workforce that's helping us with things we could never imagine. We're getting a higher quality of products. Do you think we're going to get a higher quality of life in that, or where do you? What has your reflection kind of been? Because you've been a
So,
gamer too, so you kind of understand
right.
technology. You're really seeing the growth, the challenge, and
Yes.
expansion of it.
So I'm a positive person, glass half full. And I think through every revolution of major technology, industrial, etc., there is a lot of struggle and thrashing. And
A lot of struggle with. What did you
a
say?
lot of struggle, a lot of thrashing of society, right?
Yeah.
Jobs change,
Right.
things change, right? Mechanization changed a lot of jobs, a lot less manual labor. And I think that while people like to politicize things, etc., I think a lot of the thrashing that we've seen in the last decade or so has to do with the fact that technology has rapidly advanced. It is
Right.
making things possible that were unimaginable, right?
Right.
And that changes the workforce, and people have to adapt. That
Right.
causes a lot of thrashing, and people try to take advantage of it in various ways. But the truth is, it will end, right? It will settle down. We'll have an idea of what AI can do, what it can't do, and it will do a lot. And I think that my positive outlook is it will give everybody the time to do real human work, right?
Right.
In a better way and give you a better quality of life. Listen, if you want to own your own coffee shop right now, I got to hire staff, I got to do all this, I got to hire lawyers, I got to do this. If AI is helping you all through that at a tenth of the cost, that becomes a much more attainable dream, right?
Mm.
And all of these things become what we're doing here, right? Podcasting, right? The ability to communicate one-on-one, broadcast it out. That's new,
It is new.
right? So yeah, everybody becomes a little more who they really want to be. I think it empowers that. And that's my positive outlook. And I think that will actually, in the end, create more human connections.
Create more human connections. Isn't that interesting? What do you think is the limitation of AI that you've seen that you really that we be mindful of, that we shouldn't be so afraid of it because there are limitations? What are the
So
limitations that you've
we
seen?
are. So I can code. I know the math. I have challenged groups of new software engineers who come out of very good programs that know AI and can code, and I sat them in front of a computer and said, from a blank screen, write me a 2-layer feed-forward neural network. Half of them can't, which means they do know AI, but they don't really know it. Like, I feel like, listen, if you haven't rebuilt the transmission, then you may have studied it, but you haven't really done it, right? Go do it, right?
Right.
So there's a lot of promise and a lot of hype about it's going to be, artificial generalized intelligence. I wouldn't be afraid of that. The things that humans do well are what we're doing now. We're not trying to do the math or figure out the connection across thousands of dimensions of data to figure out which proteins are going to react in a body after you give them this drug. That's what a machine does really well.
Right.
But that doesn't matter. That's a lot of math done really fast, right? That's what computers are good at. Right. Even the language model is still a lot of math done really fast, right? It just seems like it's language to us, but to the computer, it's not.
Right.
So what we shouldn't be afraid of is it takes away human things, human art, sports, all the positive things that humans do and are. It doesn't take any of that away. It takes away the stuff that you were really doing as a human anyway, right? If all you had to do is take this paper, read for this thing, stamp it if it was this thing, and then put it in this pile if it wasn't, that's not really using your brain.
No.
Right? Maybe a computer can't do it now, but an AI will be able to do it. So we can take away that mundane task and let you elevate and move forward. So I wouldn't be afraid of it. I would look at it as, a way to free us from a lot of mundane tasks.
Right.
Self-driving cars are a perfect example, right?
Yeah, no, absolutely right. So let's go a little bit about you. How did you get on this journey? So what made you so interested? How did you get into AI, and what have you kind of done in the past that kind of led you to this job, right? Led to this moment in your life?
Yeah, I stayed at a Holiday Inn Express. No, only some people will get that, but no, dating myself, I guess, too. But no, I immediately, like, my first job, my first real job was actually in financial services.
Okay.
Doing estate planning. And at the time, the principal of the firm was like, I need a better way to analyze all the possibilities for these high wealth clients and, trusts. And so I wrote software that did it.
Really?
Yeah. And
wow.
I didn't know, 21, right? So I'm writing all this software, it does all these analyses, it does all these probabilities, and, mashes all those things. This is what you should do, in these probability.
How did you write on that? Did you know code before, or is
I was coding as soon as I had a computer.
Okay.
I had my first computer 12. So
wow.
Yeah. So my first coding was in what's called as opcode.
Okay.
It's not even machine language. You're actually typing like 09, A4, 6B, right? Anyway, so really dating myself. But anyway,
I used to HTML, so I used to be a webmaster.
This is you couldn't do. Yeah, this would be like really long if you had to do an opcode. So I wrote all the software. It did all these really, Matt and the principal was like, holy crap. So she took it to Cigna and showed it to them. And they had a division that like did this type of stuff for high-level individuals. And they're like, where did you get this software? She goes, the office manager wrote it. I was the office manager. And then she came back and she said, I remember this. She said, Dave, this is what you need to do. She goes, and I'll help you along your journey, but you should not be, as much as we love you here and you do a great job, you need to do this.
Really?
Yeah, and she was an amazing person. And so the next thing I knew, I was programming, I was helping program power control systems for one of the power utilities. And now I was with professional programmers, and they were just like, apparently I was a really good coder. So
wow.
Then I went to my first startup. We wrote software. Our software ended up getting used by tens of thousands of people. And my journey began, and I just ended up in these spaces where the problems were very complex and very big. I have to mention, the next job I had was at GE Travel.
Okay.
GE Travel at the time was the largest consumer of travel in the world.
Largest consumer in the world. Okay.
of travel, larger than the U.S. government. So, and the problems are intractable, right? They are what's known as the traveling salesman problems, right?
Right.
So mathematically they are extremely difficult to solve with their complicated paths. And the lead of our group, just so you know, the talent came from the Star Wars Defense Initiative. That's who
Wow.
they hired. Yeah. So we were working with huge sets of data. I'm working with these brilliant engineers and mathematicians, and I got hooked. I'm like, this is for me. Big data, very complex problems, and away I went.
Wow. That's kind of cool. So what kind of coding do you have to do? Did you do coding mostly then, or is it managing teams of information, and how does that work?
Yeah. Early on, obviously coding. I continually profess this. I like companies generally that have somebody at the helm that has done what the lowest rung has done, right?
Yeah, great.
Right. That's actually why I like the new CEO of like Red Lobster. Like he's a young kid, but he also served food, right? He worked in the restaurant business,
Right. Very
right? So
good.
you know the business. You really know what it's like. So I
Yeah.
think you have to code. And then I started managing and architecting larger systems. I enjoyed managing engineers because I could still code with them, kind of have fun.
And they respect.
Uh, and they respect you,
Yeah,
right?
they really
You can
respect.
help solve the problem. We had some very fun problems that we would solve. Um, so that was fun. And then, as you move up, if you have a talent for kind of getting people to get on board,
Yeah.
right? You just end up moving up, and they still respect you. So that's kind of that journey.
That's so exciting. Wow, that's a great journey. So now that you're at Dane Health, we're kind of coming to a close, but now that you're at Dane Health, where do you see it going in the next couple of years? And on what are you guys doing to market this? You don't really have to market. You're marketing very niche to then
Yeah,
the various hospitals and stuff like that, correct?
yeah. Uh, so I see this going into the hospital systems and the care providers. Um, Out of that, there are some interesting things we should do. Actually, it's interesting you mentioned Vita, integrative healthcare. So our CTO, Professor Joshi, his father was a naturopath.
Oh,
Um, yeah, so we very firmly believe in allopathic and naturopathic together work better than just
right.
one or the other.
Exactly.
So and it completely makes sense, right?
It does
So
make sense.
the next areas we're going into are probably NGX. So you can do pharmacogenomics, for example, for pharmacological products,
Okay.
and then look at translation expression studies. But you can actually do the same thing for nutrients,
Okay.
right, and supplements,
Okay.
because slightly different genes do that metabolism, right?
Right.
So you can actually better tune that. There's actually an actual outgrowth, right? Because brain injury, not a lot of things pass blood-brain barrier, right?
Right.
Nutrients do.
Okay.
So some do, but some do. But you can also get if you can program that a little better, you can kind of improve brain health also. So we see that as a natural outgrowth of creating some type of AI system that will guide a person along with NGX into a better path toward recovery. But obviously, you could expand this into other areas of the clinical space as well. And like you said, consumer. But we're focusing kind of on, I think, that first path.
That's so interesting. So you could really, with this tool that you have, you can really almost like sell the idea to other industries in a way.
Yeah, yeah, we have considered licensing it that way.
Yeah, licensing it that way.
Yeah,
It's a smart tool. How exciting.
it is exciting.
Wow.
It's fantastic. It's fun.
I'm so glad I got to talk to you. I never even realized this. This is really powerful. That's a
Yeah,
powerful tool that you have. So, wow. So where do you think society is going to be in the next 2 years? What do you like? Where do you think? How is this going to set the framework? Because what we kind of say here is we're at the end of the winter of the fourth turning of society. We're going into the new golden age, and there's like this
yes.
component of which an author I like, age of Genesis. We have 4 years to define the next 80. So, what are you thinking? Some of the places do you think, or fundamentals do you think is going to change?
I think there's going to be significant shakeout in the next 2 to 4 years of kind of what works and what doesn't work across a number of industries, right? Tesla has their self-driving. It's okay. I'm not anything against Tesla, but I watch Waymo is out here already doing it,
Oh,
right, in public. So I think there's going to be some winners and losers that happen. The market's fickle, so who knows what actually happens. But I think there's going to be some shakeout, and I think that there's going to be a little bit of settling of the froth, if you will, around the chips and everything else. TSMC is building their big plant here. They'll be further along to completion. We'll be able to make the chips here. I think that will further settle the market. And I think that sets the next 2 to 4 years of what do we do with this now kind of known tech? What do we do with it? And I think that that's where you'll see, like you said, in the next 2 to 4 years, operationalization of this, whatever, turning it into operational capability. I think that's the big thing. Right now, it's still like people play with it. Right? Write my resume. Okay. But like you said, this can really do a lot in business. And I think that's what we're going to see. I think we're going to see it deployed in the next 2 to 4 years as things kind of settle down.
Oh, that's great. So where do you get your news on AI?
Contacts. So, yeah. So, I mean, I know the SC AI group at ASU, they're, far in advance. And I just talked to a lot of professors that teach this. And look, you could say what you will about anything. You want to know where the new ideas are coming from. They're coming from smart kids and professors in universities. They just are, right? You talk to these people. There's a group that I work with that is run by Dr. Joshua Damood, and they are looking about how small can you make an intelligent agent? Can you make it a grain of rice? Can you make it smaller?
Oh, wow.
Right, so that they do useful things. So the ideas that people are working on are so wild and out there, and it's that generation that's going to do it. And who funds that? Who funds crazy ideas? Corporations don't. They get grants. They get $100,000. Listen, $100,000 for a kid in college is like, that's a whole group pizza for 2 years. And all of a sudden, what do you get out of it? ChatGPT, right? Something just blobs out of it, and you go. I mean, ChatGPT, all this came out of one paper.
Really?
Yes.
Oh, tell me about it.
The paper's name is All That It Takes Is Attention. I can send you the link to it.
Oh, yeah, please do. I'd love that.
Yeah, and that paper, out of a university study, created $1 trillion market. It's why I'm always like, people like, grants are a waste of money. And I'm like, are they? The internet, web browsers, plastics, Google. I'm like, so yes, there is a ton of waste in it, but the winners are so good. It's very hard sometimes to go, you sure you don't want to bet on that cool winner? Because it's going to happen again.
Wow. You're so right. Because I love working with universities. I love being around like just new ideas. And you're absolutely right. That's where the ideas come from.
They're young kids. They have no fear, right?
No fear. They don't see
right?
the boundaries.
And a weekend of pizza and beer and 4 guys coding and some gals out there yanking out code, boom, boom, boom. All of a sudden,
you got something fantastic.
Facebook, right? Facebook came out of a bunch of university kids program.
Right.
Stuff. Right? Now it's
wow.
They're the future.
Thank you for the insight. You're absolutely right. That's one of the things I try to get myself more plugged in, because I think it's so important if you're going to learn that's where you're going to go. So.
Yep.
Well, thank you so much for your time. This was fantastic.
Yeah, really enjoyed it. Anytime. Happy to chat.
Thank you.
Thank you.
Thank you for listening to the Public Figure Society podcast, where innovation meets influence. If you love this episode, be sure to subscribe, follow, and leave a review. Connect with us on social media and join the conversation. Until next time, keep innovating, keep influencing, and we'll see you in the next episode.